Welcome, everybody. Good afternoon, and thank you for joining us for our webinar, Ready Together, Planning for Emergencies. If you don't know who I am, I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council. We're really glad that you're here today. This is the first emergency preparation training that our council has offered, and we hope that it will be the first of many. We'll share with you more about future opportunities at the end of today's presentation. We are pleased to partner with the Disaster PrepWise team from the University of Iowa College of Public Health to bring this training to you today. I'm sure as folks know, emergencies can happen at any time, and being prepared can make a significant difference in keeping ourselves and our families and our communities safe. So today's session will provide some information and tools to help all of us really be more prepared for emergencies as they occur. Just a couple of housekeeping things. There is an interpreter, Jeff, with us today, who should be pinned for you. We also have a closed captioning option down there at the bottom. If you hit those three little dots, that should bring up the closed captioning. We will have time for questions at the end, but Nick is also okay with answering some questions throughout. So if you do have a question, you can put it in the chat, or you can raise your hand. And we'll try and get to you for that too. So I'd now like to turn it over to Nick Ostrom, who's the program coordinator with our Disaster PrepWise team, to get us started today. Thanks, Nick, for being here and providing this training for us.
Awesome. Yeah, thanks so much for having us, Brooke. So my name is Nick Ostrom. I'm one of the program coordinators for Disaster PrepWise. We're a program based out of the University College of Public Health. And just a little bit more about us. So Disaster PrepWise is a research-based preparedness program that was created by Professor Sato Ishida here at the College of Public Health. We offer all of our services totally for free. We're funded through grants, research grants, and other kinds of grants, as well as volunteerism. AmeriCorps is a big part of our program. I'm an AmeriCorps member right now, actually. So that way we're able to provide everything that I'm talking about today totally for free. And we also partner with lots of local nonprofits and government agencies. We've got a lot of friends all across the state. I'm so glad this summer we're making a new one here with the Iowa Developmental Disability Council. It's awesome. So what sorts of disasters may impact Iowans? It's summer right now, so probably the one that is on everybody's mind is thunderstorms. We've had so many over the last few months. We've had some tornado watches. As it gets into winter, you'll see the extreme cold, the blizzards. You also might not know, but the most common type of disaster here in Iowa is actually a house fire. And so there's a lot of different things that you have to look out for. In particular,
Nick, I'm sorry to interrupt you, but did you mean to be sharing your PowerPoint right now?
Oh my gosh, yeah, wow. Thank you. All right.
Let us know if there's any issues with sharing that.
Okay, there.
There you go.
That's okay, thank you, yeah. That one I can kind of explain. It would be much harder to explain this graph without images, I think. And so the number of disasters is increasing every year. So this graph, this is a graph that shows you from 1980 to 2023. Each of those bars represents 1 year, and the bars themselves represent the number of billion-dollar disaster events that happen in the United States. The colors represent different types of disasters. The green ones that you see get really big towards the 2010s and 2020s. Those are going to be severe storms. The yellow ones are cyclones. Some of the other smaller ones include flooding, winter storms. Somewhere in there around 2020 is the derecho. But what this graph is showing is that as time has gone on, there have been more billion-dollar disasters. And this is even accounting for CPI as well. So between 2000 and 2009, there were $6.7 billion disasters every year. The next 10 years, 2010 to 2019, there were 12.8. And even in just 2020 to 2023, they were averaging $20 billion disasters every year. So you're seeing like a 3 times increase from the first 10 years of this decade. And so disasters are a very, just like a common reality. Everybody is going to have to deal with them at some point. Um, but why is preparing for them specifically so important? Why can't we just take them as they come? Well, being prepared has a lot of benefits. Being prepared will help reduce health problems, both during the disaster as well as after. Being prepared encourages people to take action. If you know what you need to do in a disaster, you're more likely to be able to do it. It also helps you to collect the needed supplies so that you have everything you need. It will help decrease stress and trauma. Disasters are very traumatic, they're very stressful. And some of that stress and trauma can affect your health. There's been a lot of really great research shows the connection between stress and trauma and physical health. And so keeping yourself prepared means that you're going to see less stress and trauma in a very stressful time. All of these things together will help you to stay independent and healthy. And that is what we are focused on at Disaster Prep Wise. We want to make sure that people are able to maintain their independence and their health. Now, people with disabilities have a particular risk factor when it comes to disasters. People with disabilities are more likely to have problems when big, bad disasters happen. Um, and people with disabilities are less prepared than people without. And that number is actually growing. So more people with disabilities have reported not having a preparedness plan in 2023. So 84% versus 2013, there were 71% of people with disabilities not having a personal preparedness plan. Um, People with disabilities are also 4 times more likely to be forced out of homes after disaster, which sort of, it makes it hard to maintain that independence when you're not able to return to your home. And so it's particularly important for people with disabilities to have a plan. Now, when we talk to people and we ask them why they are not prepared, we get many different responses, but they all kind of boil down to one of these three categories. People will say, well, it won't happen to me. Some people will say, well, there's somebody will take care of me. I don't have to worry about that because someone else will take care of me. Um, and well, this is just too hard. And some of these things can be true in circumstances. And I'll talk a little bit more about a couple of them later, but um, it won't happen to me is just not true. Um, I showed you the chart, but even more persuasive than charts and numbers is personal experience. Pretty much everybody in Iowa is going to have a story about a disaster. If it's not them, it's a friend or a family member. Um, and here in Lynn County, we go to, or when we go up to Lynn County, pretty much everybody can tell me where they were when the derecho hit. My sister and brother-in-law were living there at the time. They were without power for a couple of weeks. They couldn't get out of their home right away. And so everybody, even if you say to yourself, well, it won't happen to me, odds are it already has at some point. And it's very likely that it will happen again. And so it won't happen to me. That one is just not true. The other two, it's a little more complicated. So somebody will take care of me is a true statement. There are two types of people who will take care of you. There are emergency responders. Emergency responders are incredible. I've, gone and talked to firemen. We work a lot with, emergency management agencies who work with the emergency responders a lot. And emergency responders are really incredible. It is their job to go into these events and help people, which is awesome. But the reality is that there is just not enough of them. On average, there is one emergency responder for every 1,000 people, which means that the odds of you being the first person that they help are about 1 in 1,000. Um, and in reality, they are going to prioritize the people who need help the most. And so you want to make sure that if you're not in a great deal of danger, if you're not super close to the event, or if you have the capacity to evacuate yourself or evacuate, um, that you're able to do that so those resources are safe for the people who need the most. There's also another group of people who are going to help you. That's your friends and your family, your community, the people that you know, the people that you work with, the people that you live by. Um, those are the people who are going to come and help you when a disaster happens. But those people are not psychic. And so if they don't know what to do to help you, then they're not actually going to be able to help you. And so you need to make a plan to make sure that people know what they need to do. The last myth. This is too hard. It's true. This is too hard. This is a lot of stuff to remember. This is what I would have said, before I started working with Disaster Prep Wise. Somebody asked me, why are you not prepared? It's a lot. There's questions to ask yourself. There's things that you have to do. But that is where Disaster Prep Wise comes in. So we want to make this easier for you. We want to simplify this so that you believe that you can prepare yourself for a disaster. So now that I've told you why preparing is important, I want to talk a little bit about how to actually prepare. So FEMA, the Federal Emergency Management Agency, it's their job to take care of all of the disaster stuff all across the country. They'll come and help. They'll help people prepare. They'll help people respond. They'll help people recover. And so it is FEMA's job to know as much as possible about disasters. And so we follow FEMA's recommendation when it comes to disaster planning. And FEMA's recommendations are threefold. First, be informed. And just by being here today, listening to me talk, you're already checking that one off the list. You are going to be more informed now than you were when you woke up this morning. Number two, make a plan. So that just means you want to make sure that you have a plan. And build a kit is number three. And so Disaster Prep Wise will help people take care of making a plan and building a kit. So the ultimate goal, according to FEMA, is to prepare you to be without outside services for at least 3 days. So you want to make sure you have the plan and the resources to be without outside resources for at least 3 days, because 3 days is the kind of average. This is about how long the average disaster is going to affect people. And so if you're ready for those 3 days, you're going to be ready for a vast majority of the things that could happen. It's also important to note that our program helps you prepare for any type of emergencies. So that slide at the beginning with all those different pictures, the plans that we help people build will work no matter whether it is a tornado or a storm or house fire. So there's a chat. Yes, I think will these slides be in the chat? That's a technical question. I can send them to people.
I'll
Yeah.
answer that, Nick.
Okay,
Thanks. Yeah.
cool. Yes, so all kinds of emergencies, and that even includes non-disaster emergencies, non-weather emergencies, medical emergencies, family emergencies. This plan will help you prepare for any type of emergency that you could come up against. And so we at Disaster Prep Wise, in order to help people build their plans, we have 5 steps that we ask people to do to help them prepare. I'm going to go into more detail on each of these right now, actually. But the 5 steps are: step 1, completing a personal and household inventory. Step 2, developing a personal emergency support network. Step 3, compiling important emergency information and documents. Step 4, keeping a 3 to 5 day supply of medications and medical supplies. And step 5, building an emergency supply kit. So, completing a personal and household inventory. What that means is that you want to ask yourself questions about how you will hear about disasters. So you want to know, will you be getting alerts? Alert Iowa is a great resource that I'll talk about a little more, and they will send out alerts to you when other weather or other things are happening in your county. But you can also go to your favorite website, your favorite TV channel. If you know the radio station, you can listen to one of those. Any of those ways will be able to alert you about emergencies. You also want to make sure that you're thinking about the things that will warn you about emergencies in your own home. We ask a lot of questions about smoke detectors because those are really crucial to help you respond to house fires as soon as possible. The next set of questions you need to ask yourself is about evacuation. Can you move to a safe place? And we kind of mean this in two different ways. Is there a safe place in your home, and how do you move to that? And is there a safe place outside of your home? How do you move to that? So if you need to leave home, do you need any sort of specialized transportation? Do you need personalized assistance? We're asking these questions to make sure that you'll be able to evacuate no matter whether you're sheltering in place or sheltering out of place. And third, we ask some questions about sheltering. Do you have somewhere to stay in your home for those 3 days? Do you have somewhere to stay outside of your home for those 3 days? And then we also ask some questions about your ability to return home and recover after the emergency. We also encourage people in step 1 to think about their own personal abilities and needs. So when we ask all of those questions, we also ask about assistance and assistive technology. So if someone needs assistance, it means that they might need someone to come and help them do something. So one of the questions is, do you change the batteries in the smoke detector every 6 months? And so if someone says, well, I can't really do that because I can't reach the smoke detectors, they need some assistance. They need somebody to come and help them out with changing those batteries. Similarly, do I use assistive technology is about, do you need a thing to come and help you? So if the answer to the question, can you hear the alerts on your TV or your computer is yes, as long as I have my hearing aid in, then that means you use assistive technology. And so we ask both of those things to make sure that we're considering those abilities and those needs as we continue through the rest of the plan. We also make sure that people are planning for a bad day rather than a best case day. You know your body better than anybody else, and so you might know, well, some days my hearing isn't working perfectly, or some days if it's raining, my leg acts up a little bit. And so you want to make sure that you're planning for those scenarios rather than you feeling your best, because weather is not going to wait for you to be feeling your best. It's going to come regardless. And so you want to make sure that you're planning for all of the possible scenarios. Step 2, developing an emergency support network. So once you have all of those questions asked and you know what you need help with, you know what you might need people to do, it's going out and finding those people. So a personal support network can be family. We say family you don't live with here because the disaster prep wise plans include everybody in your household as a part of the plan. And so somebody in your household can't be a part of that personal support network. So it can be family you don't live with, people from your place of worship, friends or people you work with, neighbors. It can be people with similar needs. If you're somebody who uses a wheelchair, it would probably be a lot less stressful to shelter somewhere that is wheelchair accessible. And so linking up with people with similar needs for your personal support network is a good idea. So we recommend at least 3 individuals for your personal support network. We recommend at least 3 because It helps to have people with different skills. We ask about a lot of different kinds of tasks. And so you might need someone to help you with alert and warning, which means that if somebody might be really good at telling you when something is going to happen. They're always on top of that. That would be somebody who can help you with alert and warning. Um, but somebody who doesn't have a car might not be able to help you so well with transportation. And so having different people with different skills means that you're going to have a more well-rounded support network. It also helps just because people might not always be available. If a disaster is big enough and one of your neighbors is on your support network, they may be dealing with some of their own stuff too. And so having multiple people who are able to help is going to give you options. So I'm sure that most of you can think of at least three people who could help you. And I'm sure that most of those people, all of those people that you were thinking of, are willing to help and want to help you. But like I said before, those people, they can't read your mind, and so they don't actually know what you need unless you tell them. And so it's good once you know who you want in your support network to talk with them. You want to provide them with specific, detailed instructions about any special care that's needed. Also, you might want to explain what you might need to recover from a disaster. Those people will have a better sense of what they need, and it will be able to help them confirm that they can help you. And then it's also important to keep reconfirming with them every year or two, just to make sure that they're still able to help you. Some people, their health capacity changes, their location changes, and so you just want to keep going, keep making sure that they're able to assist you, and you can provide them with updated instructions. So, step 3, you want to get together all of your emergency information and all of your important documents. So, when we build a plan for disaster prep wise, we build it for households with multiple individuals. And so each person in your household is going to need, uh, they're going to need their personal information, name, address, phone number, things like that. They're also going to need their medical information. So medical condition, allergy, blood type, care instructions. They're also going to want provider information. So for each person, you're going to want to make sure you have phone numbers for doctors, preferred hospital for emergency care, um, your where you get your prescriptions picked up, your insurance, and having all of this stuff gathered together will make it easier to get the care that you need no matter where you are. You have those phone numbers. You're going to be able to call people. If you're sheltering somewhere else, you're going to be able to hopefully transfer prescriptions, things like that. You're also going to want some emergency contacts. These are people who may not be able to help you as a part of your personal emergency network, but they're people that you want to know how you're doing. So if you have a family member who lives in, say, New York, they might not be able to help you in a disaster, but if you want them to know, if you want people to reach out and tell them how you're doing, you want to make sure you have a list of those people as well. We also recommend that people think of some emergency meeting places. The common wisdom for house fires is that you want to have a place to meet outside of your home that's still close enough to your home that everybody can see it, where everyone can meet after they have evacuated, so that everybody can be together before you move on to the next place, and you're not leaving anybody behind. This same logic can hold true for bigger disasters as well. So if you have something big, you want to make sure that you have a meeting place where everybody can get to, that everybody can meet at before you go on to wherever you're going to be sheltering. So we recommend places like public places, parking lots, parks, community centers, things that are very easily accessible, and things that everybody knows where they are, so that everybody can meet and know where to go, so that you can figure out where to go next. It's also important to keep this information up to date. Disaster PrepWise uses an account system, and so when people are building a plan with us, they can continually keep this stuff up to date. But even if you're just building a plan for yourself on your own, it's important to look through it every year or so. Make sure that you're updating things, your medical information, personal information, if you have any new providers to add, keeping all that stuff up. Now, once you have all of this information together, um, you want to make sure you know where the best places to keep it are. So you can make copies of your plan. We recommend making as many copies of your plan as you want. And so you want to have at least one, you want to have one of them in your take and go bag, which I'll talk about a little bit in step 5. Having some of that emergency information on the back of your door or your refrigerator, which are both places that emergency responders will check first for information when they're coming in if they have to come in. You can keep it in an out of town location. So if you're sheltering with somebody out of town, they have a copy, or even having a copy stored somewhere on the internet, even if it's just been emailed to yourself, having that available will make it easier to get at. You can even keep it in other places, keep it in your car, keep it in your purse, keep it in your wallet. Um, we just recommend the more places that you have it, the more likely it is that you'll be able to use it. Um, Now, generally speaking, when people have disasters, is a great time for people to band together and come together and feel a really great sense of community. But the unfortunate reality is that sometimes there are people out there who use those opportunities to try and take advantage of people. And so scams are not uncommon during disaster situations. I've heard many stories from people in Cedar Rapids after the floods, after the derecho. Um, you know, they went through some stuff to try and get their lawn cleaned, or they had somebody come offer something that was too good to be true, and they ended up having to take a lot of time to deal with the aftermath. And so there are a few things that you can look out for. You can look out for people who are trying to pressure you into something, make you sell you something right then and there. If they don't give you an opportunity to think about it, they probably don't want you to think about it. They also want to make sure that you're watching out for people asking for financial information. So if they're asking for credit card numbers or bank numbers, those are things you definitely don't want to give out, even in a disaster. And you can also look out for people who are providing services just by the word of their mouth. If you just have a conversation about it, it gives them the opportunity to come back and change the story later. And if there's no record of anything, then you can potentially have to deal with that. So step 4 is keeping a 3 to 5 day supply of medications and medical supplies. So, as I mentioned at the beginning of the section, the ultimate goal is to be able to care for yourself for at least 3 days. And so, a big part of that is making sure you have the medications and medical supplies that you need. You want to refill prescriptions and supplies as soon as possible. You want to make sure you're not waiting until those things are gone to refill them. You want to try and refill early as much as possible so you can build up a little bit of an extra supply and put that extra supply in your disaster kit. Now, there are some things that are not going to fit in your disaster kit. Some things literally just won't fit. If you have a walker or something really big like that, that's not going to fit in a backpack. But there's also things like insulin that have to be refrigerated. There are things that require, being plugged in. And so there are a lot of things that will not fit in your backpack. And so you want to make sure that you put a big sticky note right on the front of that backpack that says, get insulin, get walker, get whatever it is you need, so that you'll get those things if you're having to evacuate. Now, I know that it's really easy for me to say, oh, just go get some refills. And the reality is that there's not always the ability to do that. And so we have some questions. We have what we call our emergency medication plan that has some questions that you can ask your doctor or pharmacist. So you can ask things like, what do I do if I can't get my treatments or if I'm running out of my medical supplies? Can I stop taking my medicine safely? How do I do that? Can I take a smaller amount and have it last longer? What sort of changes do I need to make if I am stopping or if I am reducing that medication? Um, we think that this is important, and these are all questions that you can have written down, asking a doctor or pharmacist, and that's stuff that you can keep in your emergency plan as well. Step 5 is building an emergency kit. So this is when people think about disaster preparation, this is the part that they actually think about. Going and getting a big plastic tub and filling it with canned food and gallons of water and all that stuff. Um, we that is good. We like the gallons of water, but it's a little more. There's a little more to it than that. We recommend breaking that into two pieces. So you'll have your shelter at home kit, which is going to have your blankets, food, water, can openers, and, first aid kit, towel, sleeping bag, cleaning supplies. Um, and there are more things on that list, but those are the things that you will need if you're having to stay at home for those 3 days. Your take and go bag is going to have things that you will need if you're having to evacuate your home, as well as things that you might need while sheltering at home. Your copy of your emergency and medical information that is going to be beneficial no matter where you're staying. But things like a flashlight, a radio, a whistle. A whistle is very important. A whistle is way louder than your screaming or your yelling will ever be, and it takes way less air. Um, and so that's sort of the sort of stuff that you want to make sure you have in your take and go bag. Once you have all of the objects that you need, um, you can find a container to put them in. We use an image of a backpack for the take and go bag, but depending on how much stuff you have, it can be very heavy. And so we have some recommendations, potentially something with handles or wheels. That way it reduces the amount of impact on your body. We've had people recommend fishing vests before, if everything is small enough to fit in those pockets, it's a really great way to distribute the weight evenly. Um, as for your stay at home kit, again, the big plastic tub is nice and probably keeps everything safe. But if things get too heavy, it might be hard to maneuver. And so you want to make sure that you have something that's not just sturdy, but uh, maneuverable. You can move things easily, and so you can kind of see in that picture you've got your big black plastic trash container. That's something that we've had recommended to us that actually makes a lot of sense. Those are designed to be maneuvered by everybody, and so uh, you just want to make sure that it's big enough to hold everything, that it's waterproof, uh, and that you can actually use it. So those are the 5 main steps that we have people go through in disaster prep wise. When people go through those, you are immediately outfitted with a lot of different action steps, things that you can do right after you make the plan to help prepare yourself. You have people that you can talk to. You have all of the emergency information and documents that you need. You have all your medications and medical supplies together. You have your emergency kit ready to go, and so we have that is what we recommend for everybody. But we also have some special considerations. So we have 2 extra modules. We have one for pets and service animals, and we have one for Alzheimer's and dementia. So the pets and service animals module, that looks a lot like the module in step 3. So you're asking yourself a lot of your same questions, like information about what your animal looks like, what your what their vet is, what their vaccination information is, what their diet is, if they have any medications, asking kind of all those same questions. Because for pets, a lot of times they're maybe not able to shelter in the same place as the people. And so if you have all of that information ready, whoever they are sheltering with will be able to help them stay a little more sane. And as for service animals, those are able to stay with anybody anywhere. And so we also have information about making sure that the importance of your service animal is noted, no matter where you are going. For Alzheimer's and dementia, we have a care plan that we have people go through that asks a lot of questions like, about routines and about scheduling. Because for people with Alzheimer's and dementia, one of the things that benefits them the most is maintaining a steady routine. And so keeping down as much of that routine, keeping down as much uh, things that make them feel comfortable will help whoever is helping them in a disaster keep things as comfortable as possible. In addition to those two modules, we have a lot of other information documents, not like modules, but just things that you can read about other topics that might particularly interest you. So, what to do for your car, how to respond to disasters in your car, what sort of things to keep in your car, how to keep your home safe during a disaster, how to stay safe during a disaster at work, and then how to maintain your emotional well-being. As I said, stress and trauma are very connected to your physical health. And so, uh, as much as possible in a very stressful situation, it's good to kind of keep yourself centered, make sure you're, trying to breathe, stay calm, because maintaining your stress level is going to help you as you recover from the disaster. We also have information about specific types of disasters. So the plans that we have people build, those are going to work for no matter what type of disaster it is. But we do know that there are some types that are more relevant than others. Like I said, tornadoes and storms are very big at this time of the year. But if somebody is new to the Midwest and they don't know how to respond during a tornado, um, we have a document that has all of that information. It explains what to do. Get to your basement, get to the lowest room in your house, the centerest room of your house, things like that. And so we have documents for other specific types of disasters if you have any questions about specifics. We also have functionality with Alert Iowa. Um, I think Alert Iowa is something that's really amazing. It's kind of unique among states. Iowa is the only state that has like a statewide emergency notification system. It notifies people by county, and the counties help operate it, but IHS is the ones who are kind of overseeing the whole thing, and it's a really, really awesome program. I get the alerts whenever we get the warnings here in Johnson County, and it's just very useful. You can kind of sign up for basic alerts, or there's a more full profile that you can fill out that some counties can use for their emergency services to help them respond to the people who need the help the most. Um, and so, because they ask a lot of similar questions that we do, we have the ability for people to go take the information that they put in their disaster prep wise plan and put that in their Alert Iowa account as well. We also have a lot of other really awesome resources. We've got a bunch of checklists. I talked about the preparation for the at-home kit and the to-go kit, but we also have checklists that are more specific. So an animal supplies checklist, a vehicle supplies checklist. We also have special personal considerations. So for people with certain types of health concerns, whether that's visual and audio, whether that's communication, whether that's somebody who uses a wheelchair, needs a wheelchair repair kit. We also have some specialized checklists for those. And we also have other resources. We've got that emergency medication plan. We've got a checklist of important documents. We've got in case of emergency cards that you can keep in your purse or wallet. We've just got a lot of really awesome resources, and we're adding more all the time. And so we have a lot of different things that people can use. All right. So that is everything that disaster prep wise has to offer. You guys are now more prepared for a disaster than you were 41 minutes ago. So congratulations. um, so once somebody completes disaster prep wise, participants are left with all of that information that I just talked about, all of those steps, all of the extra modules, in an easy to read, accessible packet that is personalized to you and your household. It's you get it as a PDF, so you can print it, you can email it, you can keep it on a flash drive, you can do whatever you want with it, and most importantly, you can continue to access it. You'll have like an email and password, and that will help you keep your plan up to date as your needs change. You've also got action steps that will make you safer and more prepared. And then all of that stuff is going to help you prepare to be without outside services for 3 days. So, if you are interested in disaster prep wise, if you're interested in building a plan, we have more webinars. We're going to be doing 3 parts, and it's going to be an interactive webinar series that will help people go build disaster prep wise plans for themselves. So if you want to have that fully personalized document, you can come to these webinars. And we have a poll that will be popping up here that will ask about interest. It will be 3 parts. The dates are there. August 11th, August 18th, and September 1st. And so if you are interested in attending a 3-part seminar that will help you build your own personalized disaster plan, please let us know. We are really excited to help people dive deeper into this. Just catching up with chat here. Awesome.
I think we
Tabitha,
can
thank you for
open it
that.
up for questions now.
Yes, yes. Feel free to ask. I know I said I would take questions during the presentation, but when I get going, But if you have any questions about prep wise, about preparing, about disasters, I can answer to the best of my ability. Is there a specific home kit and to-go kit to buy? No. So there's not a specific kit. We have checklists that have items that are that you can kind of decide if you need. So the way that we ask people to do it in the web tool is just like it's not a strict yes or no. We ask, do you have this in your kit already? Do you have this in your home somewhere but not in your kit, or do you not have it all? And so for most of those items, some of those things will be things that people have in their home already. Some things will be things that they'll need to go out and find. Um, but there's not like a specific one. You just go pay a certain amount for one box and then it's all finished because different people are going to have different levels of preparedness already. And so we give people the checklists that will let them get everything that they need and nothing extraneous. Yeah, thanks, Chad.
And feel free to also raise your hand too if you want to come off mute and ask your questions. I think you did such a thorough job, Nick, that everybody's just more
Yeah,
prepared.
I'm glad. It's a lot to take in. That's that is a very common response is thought. But I'm also available to ask if you have any questions that you think of later on. Here, I'll hop to the next slide. Thank you. Thanks everybody first on. So we have you can find us so our website is prepwise.org. That has the actual web tool itself. We also have um the website on the University of Iowa that I can share with people. I don't have that link, but I can put it we'll send out the slides. And so I will put a link to our website on the slides.
Yeah,
Um,
what we'll actually do, Nick, is we'll post them to our website along with the recording, if that's
awesome.
okay with you. So they'll
Yeah.
be on the DD Council's website too.
Okay. Yes. So I will make sure that the website link is on this slide as well. And you can always reach out. The cph-prepwise.edu or at uiowa.edu is our general email address. I'll also include my personal email address if you have any questions. And you can find us on Facebook as well. We love for you to find our page and like us on Facebook. But yeah, that
Did you?
you can always reach out later.
It
Well,
looks like Tabitha might have a
Yeah.
question.
Sorry,
oh,
I
sure.
couldn't figure out how to raise my hand. Did you say that like we took that survey, if we said yes, more information will come on how to sign up for that, or
Yeah.
did I miss that?
Nope, you did not. You did not miss that. What we're going to do is send the registration to the folks that said yes, and probably to the other folks that registered too, because we know some people dropped off early. And then we're going to allow you guys that participated today the first chance to register. And then if we have some more open spots, then we'll send it out to our regular network. But if you said yes, Tabitha, we'll get the registration to you here in the next couple of days.
Great, thank you so much.
I just put my email address on our website in the chat as well.
And it looks like Herschel might have two questions for us.
Oh, sure.
Herschel, we might have to have you pinned so we can. Heidi, are you able to pin Herschel?
Yes, I've got him pinned.
I'm not seeing him. Herschel, can you come on your camera? Turn your camera on so. I'll put that in the chat too, Herschel. I'm not seeing that Herschel's been able to turn on his camera yet. Oh, he's putting it in the chat. And Nick, I can read that to you too. Can you explain about the changes going on with FEMA? How do you deal with disasters such as having cash on hand when many places are moving away from cash? Obviously, during disasters, digital electronic services would be affected.
Yeah. So I can't explain about the changes going on with FEMA because I have not read up on them enough myself to kind of speak in an official capacity. So um, I don't, yeah, I don't know is the very short answer. But I think that if there are less resources for FEMA, I think that only increases the importance of like preparing yourself and within your communities. Um, you know, I think that the preparation, regardless of how many people, how much money there is always going to be important. As for cash, so places are moving away from cash, but like you said, uh, when the systems are down, all of those places are going to have to turn back to cash. Otherwise, they're just not going to get any money. And so cash is just a really great, cash is never going to stop being useful. So we just recommend as people keep as much as they can afford to in their kit, but more importantly, recommending that they keep it in kind of a different, not just one big bill. You want to make sure that you have an amount different amounts of each type. You know, you want some ones, some fives, because if those systems are down, people aren't necessarily going to be able to make change. And so you want to have a variety of yeah, a variety of those so that you're able to get stuff that you need, even if that stuff is down. Um, yes, that is excellent. Waterproof is very, very important. Water, I actually I don't think I said it, but waterproof is definitely one of the words on that slide for both your in-home and your to-go bag, just because many disasters are very wet. You know, snow, storms, tornadoes, all of those things are going to bring rain. All right. Thanks, Herschel. That's good questions.
He might have had one more question, so he might be typing it in. Let's just give it maybe another second and see if anybody else has any other questions while he's typing that. Maybe just give it another minute, Nick.
Sure.
Oh, he did. That was his two questions.
Ooh, okay.
So last call for questions, anyone? Well, Nick, I again want to thank you for partnering with us to bring this today. It was great information.
Oh,
And
thank
everybody
you.
be on the lookout for some invitations to learn some more.
Yes.
All right. Have a
Awesome.
good
Yeah.
rest of your day, folks.
Bye.